Thank you for joining us here today. Please be seated. Welcome all. My name is Fernanda Rhode, and I serve as the Chief of the Office of Health Systems Development at the Rhode Island Department of Health. We're now going to have a brief announcement in Spanish to let you know that we have interpretation services available. A member of our staff is available to translate in the event a Spanish-speaking member of the public prefers translation services to make a comment. Margarita, please.
Trabajo con el Departamento de Salud de Rhode Island y estoy aquí por si alguien desea hacer sus comentarios en español. Estaré encantada de traducírselos. Gracias.
Before proceeding, please note that exits are located on either side here. Turning over to the slides to review the purpose and some important reminders pertaining to our joint public meeting. The Rhode Island Department of Health and the Attorney General's Office are jointly hosting 2 hybrid public meetings regarding the hospital conversion application of Centurion's proposed acquisition of Roger Williams and Fatima Hospital. Our first meeting was held on March 19th, 2024, and we are gathered here today for our second meeting, March 26th, 2024, from 4 to 6 p.m. The Centurion Foundation submitted a hospital conversion to application on November 14, 2022 to acquire the Charter Care Hospital system, including Roger Williams Medical Center and Our Lady of Fatima Hospital. The Rhode Island Attorney General and the Rhode Island Department of Health are currently reviewing this application, which has been made publicly available. This meeting is to hear public comments on the application, which will be used by each agency to inform our ongoing review. The agencies will not answer questions or offer comments on the application at this time. To review some important reminders, please sign up to speak using either the electronic sign-up form or paper sign-up sheets for those in person. Names will be called in the order that you sign up. This meeting has part captioning. Speak clearly and slowly into your microphone to allow the captioner to capture your comments. To turn on captions, please use the link provided. One speaker will be called at a time. If you are joining virtually, when we call your name, please use the raise hand feature. We will unmute you. If you are in person, please approach the microphone. Each speaker will be allotted 3 minutes to allow as many people to offer comments as possible. All are encouraged to submit written public comments if you have additional comments you wish to share. The Teams chat will be disabled during the meeting. If you would like to submit a written comment, you may email that comment to healthcare@ryad.ri.gov and fernanda.rose@health.ri.gov until March 29, 2024. Lastly, please wait your turn and be respectful of others. Representation from the Attorney General's Office is present here today. Thank you. Now I'd like to turn it over to Associate Director Jackson Kelly to offer some comments on behalf of the Rhode Island Department.
Hello, Jacqueline Kelly. I'm speaking on behalf of James Powell, who is the Deputy Director at the Department of Health, and Dr. David, who is the Interim Director of the Rhode Department of Health. I want to also thank my staff, Lady Academy World, Mike Dexter, Fernando Lowe, Delana Campbell, David Marzilli. We also have actually Kyla and Paula signing up, Mackenzie, Deb, Irv, Jim, Anne Marie, Jess, Darren, virtually. I think I covered everyone. But I did because we have a big team of staff consultants and other reviewers who are taking this application seriously and considering it, reviewing it in accordance with the statutory structure. So we're here today as part of the HCA process to take the public comment. It is part of the process. As Fernanda had said, we don't comment, but we do take it in and we welcome all of the comments that we receive. The Hospital Conversion Act, also known as the HCA, it requires the Department of Health and the Attorney General's office to review such applications as this. We want to make sure that we protect the public health, welfare, and assure the viability of a healthcare system in Rhode Island that's safe, accessible, and affordable. So I thank you, and I will turn it back over to Fernanda. But thank you.
Thank you, Jackie. Again, welcome. I'd like to review the framework around the administrative and procedural processes that will be undertaken during today's meeting. First, I'd like to note that the meeting is being recorded and will be posted on the Attorney General and the Rhode Island Department of Health's websites. We also have with us partner interpreting for CART services. So we hope to establish an audio recording and a transcript of this meeting for the record. As this public meeting is being held as a hybrid meeting, we have a large number in attendance today, both remotely and in person. In order for it to be conducted in an organized and orderly manner, I'm requesting that those participating virtually, please remain on mute until it is your turn to provide comments. Muting will help avoid any feedback and allow us all to hear those speaking one at a time. I really appreciate your flexibility in this virtual environment. As the link posted in the public notice to sign up for this joint public meeting is a live link, if you haven't already done so and are interested in providing comments during today's meeting, please sign up. For those of you in person, RIDOH staff are by the entrance, ready to assist you. Participants will be called on to provide their public comments according to that active list. It is important that persons if any, and please spell it for us so that the record is clear. Please refrain from posting reactions or engaging in chats. Each participant in this meeting will have up to 3 minutes to speak. I ask that comments provided by those speaking today please be pointed, succinct, and concise so that we have an opportunity to hear from all who have public comments to share. If you have already submitted written comments, please be advised that those are part of the record and do not need to be repeated here today. Written comments will continue to be accepted by both agencies through March 29, 2024. In place of, or should you want to supplement your verbal comments here today. We're here to listen to public comments regarding the Hospital Conversions Act application that is currently under review by both agencies. That is the Centurion Foundation, Inc.'s proposed acquisition of Roger Williams and Our Lady of Fatima hospitals. Again, all verbal and written comments regarding the application will be considered by our agencies. We want to be able to hear from you, members of the community. Aside from our introductions, the representatives from the two agencies will not be speaking in response to specific comments. However, we are here to hear and record the comments. Finally, if there are any reporters here with questions, please bring those to RIDOH's Center for Public Health Communication. Anne-Marie here is here with us today. With all of that said, I will call upon Attorney Patricia Rhode to introduce applicant representatives for some brief comments and an overview of the proposed transaction. Thank you.
Thank you, Ms. Lopes. To the RIDOH and RAG teams, thank you again for scheduling this public meeting. At this time, I'd like to introduce Jeff Liebman, Prospect Charter Care CEO, who has a few comments. He will be followed by Ben Mingle, the Centurion Foundation CEO. And I also want to recognize Steve Lavoie, Centurion's Vice President of Operations, who's joining Mr. Mingle at this afternoon's meeting. So, Jeff?
Thank you, Pat. Trying to do this without breaking it. Thank you, Pat. I'm Jeff Liebman. I am the CEO of Prospect Charter Care. I'm here today to talk about how important this is to the community, our staff, our patients. But first, let me remind you all of the important role these two hospitals play in the community. We provide extremely important services in, candidly, some underserved areas. That includes cancer care, we're known as the Cancer Hospital, elder care, busy gastroenterology. We have the largest behavioral health and addiction medicine program for any acute care hospital in the state, and in fact in the region. And our services are an integral part of the communities that we serve. I've worked now for over 2 years with Ben Mingle and the Centurion team, including Steve Lavoie. They are excellent, they are dedicated to this project. They want to ensure our mission of high quality, affordable health care that'll continue in the community. Just one housekeeping item. I know at the last meeting last week, there were some comments about a health plan not being submitted to UNAP. That's not true. I myself saw the documentation and the information. So the leadership of the unions do have that. I would also say one other thing. If you have time to ever look at the thousands and thousands of pages in the application, which I'm sure most people don't, in there you will see that this is the only viable plan that is out there for many reasons. In particular, there's no other organization with the amount of resources like this to help us that have come forward. This will allow us to modernize our physical plant, upgrade our equipment, hire more physicians, bring jobs back to Rhode Island, and allow us to invest more in our workforce. So I look forward to the process being concluded as quickly as possible so we can get on with the business at hand. Thank you. Ben?
Good afternoon. My name is Ben Mingle. I want to thank the Department of Health and the Attorney General's office for holding the public meeting today. I'm the president of the Centurion Foundation. Pat's looking for an early promotion that I don't need. As I mentioned last week, our organization is quite unique. We work closely with charitable hospitals all over the country, helping them serve patients nationwide, and that's what we wake up every morning trying to do. To date, we've assisted 13 different not-for-profit health systems and completed more than 25 transactions financing 36 different facilities. Those transactions are in excess of $1 billion. We are experienced and have a proven track record ensuring other charities and charitable institutions advance their mission through our work. As Jeff just mentioned, we have been working together for 2 years and are confident with our expertise in the local leadership team of Jeff Liebman that these hospitals, both Roger Williams and Our Lady of Fatima, continue to provide high quality care to these communities. And with the approval of these offices, on day one, there's going to be immediate cost savings. They're going to be provided through returning to not-for-profit status and elimination of a national healthcare corporate overhead structure. We have very closely analyzed the services and finances of these hospitals and have put together a strong plan that shows the pathway for financial viability for both Roger Williams and Our Lady of Fatima to be independent and to remain and be an independent, self-sustaining health system. We look forward to a review of our transition plan and answer any questions you have through an ultimate approval process. I do want to take a moment just today to talk about the comments we got from the union last week. We heard you, and we appreciate your passion. You know, that's why we're doing this also. So it's your passion that tells me that you're the type of people we want to work with to ensure these hospitals are going to remain open, successful, and providing care to this community. To be clear, and as Jeff just mentioned, we did provide a comprehensive health insurance plan to union leadership. We believe our plan is equal to or better than the current existing plan. Also mentioned last week, and I just want to reiterate it here today, our plan provides for the hospitals to have $80 million in day one capital reserves to serve as their backstop. That's not an arbitrary idea. That is the gold standard of how not-for-profit healthcare is financed across the country. We have met with your union leadership, and we're going to continue to meet with the leadership until we have reached an agreement with UNAP. We all have the same goal here. We want to ensure these two community hospitals succeed and continue to serve these patient populations. Centurion has spent more than 2 years on this transaction. Based on all the hard work of our team, our experts, our past experience, the financial initiatives that we've identified, and the transition plan that we've put in place, we have a high degree of confidence in the success of this plan. We are committed to empowering the local leadership team, and we'll leverage all of our resources to ensure continued access and access to capital so these hospitals can flourish. Thank you very much.
Thank you. I would like to call upon Deborah Giannini. Please come to the microphone. Deborah Giannini. Lori Costa. One more time, Lori Costa. Dr. Rebecca Brown.
Good afternoon, everyone. My name is Rebecca, R-E-B-C-C-A, B-R-O-W-N, Rebecca Brown. I have been working for Roger Williams Hospital for almost 19 years. I feel as if that hospital is my family, and I take care of a lot of folks in and around the region as a geriatrician. I have been so fortunate to work where I work. One of the things I listened to all the testimony from last week. One of the things I'd like to add as a little detail, there is seriously no better health system to work at as a female physician. You know, trying to balance family and a career. I have been very supported, and as a division director of geriatrics right now, we are also trying to support a lot of women in medicine, which I think is very, very important. So I'd like to mention that. I'd also like to say that it has been extremely difficult for the past year as someone who is in somewhat of an administrative type role, when we have come up against having to ask for every single thing, paper, to pay our bills, you know, paper, bathroom keys, supplies. We have not been able to get things done. I also do a lot with the residency program, the teaching program. It has been very difficult to pay for the resources we need to maintain the absolutely wonderful training programs we have at our hospital. And a lot of those physicians, one is in the audience right now. She's our geriatric fellow. I brought her with me today as part of faculty development. You know, I said to her, this is really important and it means a lot. And we have had difficulty having our current owners pay the bills for education. So with this, I would like to say that I hope that you support this going through because we do need to move forward as an organization, and it is critically important for us to take care of our patients and educate our trainees.
Thank you. Christine Godin.
Hi, Christine, Christine, Godin, Godin. I am the Director of Emergency Services at Our Lady of Fatima Hospital. I'm a graduate of the former St. Joseph Hospital School of Nursing, and my entire career of 38 years has been at Our Lady of Fatima. I'm a very passionate person about patient and staff safety. We are a community-based hospital in the town of North Providence and take care of 26,000 patients a year in the emergency department. We are a high reliable organization for which those of you who do not know is an organization that is committed to safety and at the highest level throughout our operations for our patients and our workforces. During my career here in the nonprofit world, we had volunteers, fundraising, and a huge sense of community involvement and local leadership making a huge impact on daily operations. The last 7 years working for a for-profit changed many dynamics in daily operations. There are limits of getting new equipment, new technology, to even repairs for equipment. Prospect has hindered daily operations for many departments. Every single day, I struggle with this one question: would I recommend Our Lady of Fatima for my family and friends? Over the last 7 years, my answer could change day to day, and we've had to struggle for funding, new equipment, and resources. I've been waiting 3 years for new flooring for my patient floors in the ED. I recommend Fatima for my family and friends. I say yes, because Centurion has come forth as a buyer to bringing us back to the community of nonprofit status and to continue our mission as a strong HRO to care for the 26,000 Rhode Islanders who chose to call Our Lady of Fatima the hospital for their care, for their family and their friends. I thank you for your time.
Thank you. I'd like to call upon Jesse Martin. Jesse Martin. Dr. Hayden.
Good afternoon. I'm Dr. Michael Hayden, Michael-Hayden. I am a primary care physician with Charter Care for the past 5.5 years. Prior to that, I was in my own private practice for 31.5 years. And I do appreciate the opportunity to express my support for this Centurion Foundation. This is a national nonprofit company aiming to financially revitalize primary care and improve working conditions in the healthcare systems that they choose to invest in. A little further background, I graduated as a registered nurse from Rhode Island Junior College in 1977, so I have some understanding where the nurses are coming from. I also graduated from the University of New England, completed my residency at Cranston General Hospital, alongside several of my classmates who are in practice these days. So since 1987, I've proudly served as a primary care physician here in Rhode Island. Cranston General Hospital closure. I was a member of the Cranston General Hospital Financial Committee during the abrupt closure in 1992. Back then, the Attorney General and the Department of Health offered minimal support for this small, family-oriented community hospital. There were no hospital systems willing to absorb the hospital at that time. The hospital was closed very abruptly. The closure ultimately benefited Lifespan and the Kent Hospital systems, leaving numerous long-term employees jobless. Many never returned to work anywhere in Rhode Island. Prospect Medical Holdings withdrawal. Prospect Medical Holdings, a Los Angeles-based company, has already pulled up stakes on the East Coast. They are an investment firm that is 60% held by Leonard Green, a private equity firm that stripped millions of dollars from their hospital systems in 2018, leaving these systems financially strapped. Over the past few years, Prospect Medical Holdings has been financially withdrawing from the East Coast, leaving a trail of debt. This includes 3 hospitals in Connecticut, Pennsylvania, and Delaware. CharterCare Medical Associates. During this challenging period of transition, as well as with continued issues of COVID-19, the primary care physicians affiliated with CharterCare Medical Associates have admirably served their communities. Despite an acute lack of funding and ongoing staffing issues, our organization has continued to provide the highest quality of care to our patients. CharterCare Medical Associates, through its independent physician association, has numerous managed care contracts with Medicare, Medicaid, and various commercial insurers. These contracts directly impact the healthcare access of tens of thousands of patients throughout Rhode Island. So Centurion's proposed solution is to come in and provide our financial basis. This is a nonprofit approach, and I think that provides the best alternative for we as primary care physicians in this state in the continuation of CharterCare Medical Associates and the 2 hospitals. Thank you.
Thank you. Pat Hayden.
Good afternoon, and thank you for allowing me to speak at this forum today on behalf of the sale of CharterCare to the Centurion Foundation. My name is Patricia Hayden, P-A-T-R-I-C-I-A, Hayden, H-A-Y-D-E-N. I have been a registered nurse in Rhode Island for over 30 years. I am the practice supervisor for CharterCare Medical Associates, a primary care practice in Cranston. My husband, Dr. Hayden, and I were self-employed in private practice for 30 years before joining CharterCare Medical in 2018. This has been a rewarding experience. Since that time, the practice has expanded from a solo practitioner to 3 doctors, a nurse practitioner, a pharmacist, and a nurse care manager. We treat thousands of patients in Rhode Island and are currently accepting new patients. As many of you know from the numerous articles in the Providence Journal, there's a primary care shortage in Rhode Island. We are one of the few primary care offices in Rhode Island accepting new patients. Over the past year, we have integrated behavioral health into our practice with a licensed mental health counselor available in our office 2 days a week. Mental health has become a part of primary care medicine. Our practice has accomplished so much growth in the past 5 years, but we have much more to do. With the sale to the Centurion Foundation, a nonprofit organization, we will have the funding available to continue our growth in providing these services to more patients here in Rhode Island. Without this sale, the risk of the business closure is too great. This would be detrimental to our organization, our staff, but most importantly to our patients. Where would they go for medical care? We have the chance now to move forward with Centurion Healthcare in Rhode Island, so let us make the right choice for our patients. Thank you.
Thank you. Richard Ballard, please. Richard Ballard.
Richard Ballard, you have been unmuted online.
Are you able to hear me now?
Richard?
Are you able to hear me now?
Yes.
Okay, great. Thank you very much. Thanks for the opportunity to talk to you today. My name is Richard Ballard, Richard Ballard. And I'd like to read the letter to you that was sent to Fernanda Lopes on February 20th. Dear Fernanda Lopes, I'm writing to you in support of the HCA application in the sale of charter care to the Centurion Foundation. I'm the director of the Roger Williams Cancer Center, and I've been employed here for 4 years. This is a very important issue for us as the return to not-for-profit status will not only enhance our mission to patients, but also strengthen the relationships with the community we serve. I'm confident the Centurion Foundation and our return to not-for-profit status is good for patients, staff, regulators, and many other constituencies in the community we serve. I'm happy that we will maintain local leadership and control through a local board, so we were able to continue to invest in our clinical programs and facilities and return jobs that were outsourced by our current ownership. Excuse me. I've enjoyed my job at Charter Care and been impressed by their commitment to high-quality, patient-centered care. Looking forward to approval of this application will allow us to continue with that. Our cancer center is extremely busy, and I'm proud of the work we do every day. Even with the challenges of COVID-19, we remained open every day and did not scale back on any of our services. I feel the work we do in cancer, as well as the programs at Charter Care's hospitals, is essential both to the local economy and the well-being of the community we serve. I remain enthusiastic about Charter Care's commitment to the mission and look forward to working with their new owners to enhance that. Thank you in advance for your support of this application.
Thank you. Dr. Joseph Sammartano. You could raise your virtual hand, that may be helpful.
Oh. You have been unmuted.
Good afternoon. Thank you for the opportunity to speak to you today. My name is Dr. Joseph Sammartano, Sammartano. I'm a retired oral and maxillofacial surgeon. I was a member of the Our Lady of Fatima active medical staff from 1974 to 2021. In 1983, I was appointed division chief of oral surgery and served in that capacity until my retirement in 2021. Growing up and going to high school and college in the Elmhurst section of Providence, Roger Williams and Fatima hospitals were very familiar to me. They were the hospitals that everyone in the neighborhood went to when they were ill or injured. My dad spent the last days of his life at Roger Williams receiving very kind and compassionate care. Little did I know at that time that both hospitals would play prominent roles in my professional life, especially Our Lady of Fatima. They were the hospitals that my patients preferred to go to and the hospitals in which I felt most comfortable providing care. Currently, I serve as chair of the local advisory board of Our Lady of Fatima and I'm a member of the Prospect Charter Care Board of Directors, where we routinely review various quality and patient improvement measures. I'm well aware of the significance and the impact that these measures have on hospital operations, but I'm also very proud and grateful for the hard work by our employees that results in these consistently positive scores. However, I often wondered if the patients really appreciate or are concerned about these measures. Are patients actually appreciative of our 100% compliance rate, or the fact that there were 0 CLABSIs or COUTIs in 2023? What our patients do expect, do appreciate, and are entitled to is that our hospitals are places of healing, places where their spiritual and mental needs, as well as their medical issues, are addressed in a timely fashion, allowing them to return home and resume their daily lives. Our Lady of Fatima and Roger Williams Medical Center routinely and successfully accomplish these goals on a daily basis. Centurion Foundation's mission will increase healthcare accessibility and affordability while ensuring its healthcare holdings pursue a charitable endeavors in our communities. It will return charter care to a nonprofit status, allowing partnerships with key organizations to improve the healthcare and quality of life of Rhode Islanders. With respect to Fatima Hospital, Rhode Island has a population of slightly over 1 million people. It is also the most Catholic state in the country, with approximately 42% of the people identifying as such. Our Lady of Fatima is the sole Catholic medical facility in the state and often is a major factor in a patient's decision as to where to seek treatment. It would appear appropriate to maintain a Catholic facility in Rhode Island. Centurion Foundation's mission will provide Our Lady of Fatima to showcase its identity as the sole Catholic medical facility in the state. At last week's public hearing, emotions were clearly visible, and there was obvious uncertainty as to the goals and expected outcomes. I would ask that the parties come together and address any misconceptions so that this transaction can move forward. Rhode Island deserves nothing less. Thank you for your time.
Thank you. Dr. Joseph Espat.
Hi, good afternoon. My name is Joe Espat, Joeespat. I'm currently the chair of surgery and the clinical director of the Cancer Center at Roger Williams Medical Center. So my comments are a little more loose. I was recruited in 2007 to take over retired surgeon that many of you know, Harry Wanavo. In fact, I'm the Harry Wanavo professor. Harry Wanavo was a paragon of American cancer surgery. And so I'm going to focus my comments on cancer care in the state. We have for about 54 years, been the leading cancer hospital in the state of Rhode Island. And one of the things that I do as the head of the Cancer Center is I help manage medical oncology, surgical oncology. We have the largest surgical oncology team in the state, 5 fellowship-trained surgical oncologists, providing the majority of the pancreas and liver surgery in the state. Otherwise, these patients would have to go to Boston or right down in New Haven. So in the 15 or so years I've been here, we've been able to build a tremendous program. Our medical oncologists are also cutting-edge leading folks, and together we take care of tens of thousands of patients and Rhode Islanders that have cancer, who otherwise would go to other states. Now, I fully support the HCA application of Centurion to buy our hospitals. And let me tell you why. I'm not a big finance guy. I don't understand all the numbers, but here's what I'll tell you. When my patients from Westerly don't want to drive to Providence, because I'm not a Rhode Islander, you guys are, my kids are Rhode Islanders, you guys know that nobody wants to drive that distance, and I want to put a clinic in Wakefield, I have to call somebody in Los Angeles to approve my suite in Wakefield so that patients don't have to drive all the way to Providence. Now, I've been able to do that, but it's been a lot of work to do that. And that's not good care. So if I don't want patients to go to New Haven, and I don't want patients to go through Providence, go to Boston, I've got to provide alternatives. So going to a not-for-profit status with local care enables me to make these decisions locally. Lastly, I have some of the best trained doctors on the cancer team from major universities and cancer centers in the country. It's virtually impossible to recruit quality people to the state if we're for-profit. I can't do loan forgiveness. I can't recruit the type of people that I want on my team, and people of Rhode Islanders want to be taken care of them. So my comments are loose, but I strongly support the hospital conversion sale to Centurion because it returns things to local control and it gives Rhode Islanders control of Rhode Island healthcare. Thank you.
Thank you. Dan Eisen.
Good afternoon. My name is Dan Eisen, I-S-O-N. I'm currently the Vice President of Financial Operations. Since the beginning of my time here, there have been consistent financial challenges. Neither nonprofit nor for-profit hospitals throughout the country are immune to the challenges of operating in this current healthcare environment. High cost and low reimbursement, particularly here in Rhode Island, are not a recipe for positive financial results. Prospect CharterCare is the only for-profit hospital system in Rhode Island. Reverting to nonprofit will allow the system to be at a minimum on a level playing field with other nonprofit hospitals in the state. It's been said here a number of times, but I just want to emphasize nonprofit status will provide the opportunity for fundraising, participation in grants, and attract research funding. It will provide significant annual savings for the organization. It will allow the system to participate in 340B drug pricing, up to 25 to 50% savings in pharmaceutical purchases. This is particularly impactful for our infusion services associated with our cancer treatments. All of these benefits are critical to bringing the system to financial stability. This is a key part of the how we survive and flourish as a healthy hospital system. The nonprofit status will ensure net proceeds from hospital services will remain local and be 100% reinvested in the mission of CharterCare of Rhode Island. I strongly support the partnership with Centurion Foundation as the only viable option to move on from current ownership. The sale will benefit our community, our patients, and all of our hospital system employees. Thank you.
Thank you. Dr. Gerald Colvin.
Good afternoon, Dr. Gerald Colvin, G-E-R-A-L-D, C-O-L-V-I-N. I'm the Director of Clinical Oncology and part of the Cancer Center, and I strongly am for this HCA conversion. And just a few things. I've been in multiple systems, been in Rhode Island for 25 years, worked through the lifespan system, worked in South County, and I worked at Roger Williams initially 2001 to 2005, and then I came back 3 years ago. And I want to tell you that this current administration is the best administration that I've ever worked for. And I worked for Dr. Babineau at Lifespan. I had Mr. Osceoli, Belcher at Roger Williams, Luigi Cole. This is the best administrators, and they're going to stay in control. The board is going to stay local. We're going to be able to do things locally. And I'm going to tell you, it's very difficult to also recruit someone. I had someone that wanted to come, but because we're for-profit, there was no loan forgiveness, and we weren't able to recruit him. So it's been very difficult to recruit. I worked with Roger Williams when it was for non-for-profit and for-profit. And I think Prospect is done with their profit-making. They're a finance company. They want out. This is our best and only option. If we don't do this now, what's going to happen is they're going to claim bankruptcy, and we're going to be in big trouble. Right now, the hospital is strong. We're in a good position. I trust the mission of Centurion Foundation. I trust our administrators. I met with the head of Centurion also, and I think this would be a perfect fit. And I understand the concerns of the nurses, but you got to look at the bigger picture here. But we all work as a team, and there has to be some trust. And I'm strongly in favor of this conversion, and it'll help us with funding, with grants. When I was here initially, I had nearly $1 million grant. We can start more research and get back to where we were and where we came from. So I hope that you guys approve it and approve it relatively quickly. And I'll be the first to say, if you do this very quickly by April 1st and decide to change, my family foundation is willing to give $100,000 in matching funds to the Cancer Center. Okay, thank you.
Thank you. Dr. Prakash Sampath.
My name is Dr. Prakash, Prakash, Sampath, Sampath. I've been acting as the Chief of Neurosurgery at Rhode now for about 20 years, and I also work at Fatima. I've been very involved in the emergency in the operating room, and like Dr. Espan, I'm very, very supportive of this merger for a lot of reasons. 3 in particular. One, the not-for-profit status that Centurion Foundation is bringing to the hospital, I think it's critical. It's critical for education. It's critical to retain residents in the state by giving potentially loan forgiveness and applying for grant money that we're not currently eligible for. And it's critical for recruitment and retention of physicians. You know, Rhode Island, as you know, has a difficult time keeping physicians, both primary care and specialty. And I think the not-for-profit status is quite important. In addition, when I first came to Roger Williams, and many of you know this, Roger Williams has a long tradition and history of research. It was one of the first Brown University Medical School primary hospital. Now it's changed its affiliation to Boston University, but obviously the not-for-profit status allows us now to apply for federal research grants. Some of them are clinically based naturally, and I think this tremendously increases the capacity of the hospital to provide better care. You know, I know it's a very challenging time in healthcare. We all listen to the radio, the TV about our neighbors in Massachusetts and Stewart and places in Connecticut. We all know it's very challenging. To me, this foundation, Centurion Foundation, gives us a solid financial backing so we can refocus on our core mission, taking the best care of our patients, building some of these specialty cares, as we already alluded to, the cancer care, the elderly care, and keeping our residency and our teaching programs thriving. So, you know, I think that the last thing I want to say is that, you know, current status in Rhode Island, we really only have 1 or 2 or 3 healthcare systems. And I think competition is important. I also look at lifespan, and I think it's important to have other opportunities for our patients in Rhode Island. And I think in general, competition is good for providing the best care. Thank you.
Thank you. Dr. Gerald Marsacci? Greg Ventura?
Good afternoon. Thank you for the opportunity to speak today. Greg Ventura at BENTURA. I'm the Director of Supply Chain at Charter Care. Been here for about 7 years. Our supply chain manages over 60 million and span hundreds of contracts and over 25 employees. I've been involved in the support of this organization through many challenges. Cost improvement projects, a major system change, a pandemic, a cyber attack, payment challenges, and many other challenges that we go through. Our team continues to support our nurses, surgeons, and staff and daily treat our patients. Our team is the face of the organization with the suppliers, and through these challenges, we've done an excellent job. I support this transaction. I've worked for several CEOs, CFOs a lot of acronyms. Over the past 7 years, the best leadership team I've seen at a hospital. In addition, it's not easy to work for any hospital in the United States. The leadership team continues to support us through many challenges. This leadership team, through the sale, I believe will be in good shape. Personally, I've lived in Rhode Island for 47 years. I grew up in Smithfield. My mom worked at Miriam Hospital for close to 50 years. Hospitals in Rhode Island employ many families in this area. I love working at Charter Care. I love working for my leader, CEO Donna. I have a son, Andy, who's 9, and Vivian is 7. In a few months, they'll be 8 and 10. And they're going to play hockey, softball, golf, soccer, church, school, and on. And you guys have all been through it out there. This job allows me to commute from Cranston as part of their lives. If I need to find a new role in supply chain, I hope I'm not driving to Massachusetts. I hope I'm not traveling internationally. I would like to continue to work for Charter Care and serve our Rhode Island community and be home for hockey and soccer games. I'm in full support of this sale, moving to a nonprofit in this community. As the director of supply chain, I'm looking forward to rebuilding our relationships from local and national suppliers, leading contracts locally, and potentially adding local jobs in supply chain. I'm excited for new challenges to bid out these contracts, partner with existing suppliers and vendors, especially in the local community, and work on substantial cost improvements across our supplier network. In closing, I fully support this transaction, both as an employee and a Rhode Island resident. And please approve this transaction. Thank you.
Thank you. Dr. William Beliveau.
Dr. Beliveau, you've been unmuted online. Dr. Beliveau, you may just need to unmute on your own computer in order to offer your comment.
Can you hear me?
Yes.
Yes.
My name is Bill Beliveau, B-E-L-I-V-E-U. I serve as the chair of the Department of Medicine and the director of critical care at Our Lady of Fatima. To begin with, I would be remiss not to personally thank and acknowledge our Attorney General, General Neronha, whose foresight prevented a selling off of Charter Care's real estate. Although I am board certified in 4 disciplines, unfortunately, finance is not one of them. Will this venture succeed? Well, Yogi Berra probably said it best. Predictions are difficult, particularly when they involve the future. One thing is for certain, Rhode Island hospitals and practices are struggling. The fundamental problem, I believe, is third-party payment structure in Rhode Island. As hospital languishes, United Healthcare raked in $22 billion in profit in 23. And if Charter Care were to close, the knowledge as to how often hospitals are on diversion, it would be a disaster of epic proportion. Centurion offers really the only path forward. In listening to the various speakers, each sees the deal through their own lens. What we haven't heard much is the reason we are in this field, that is, the patients we serve. Despite all the bad press, Fatima census continues to increase at a level over the last several months I haven't seen in years. Fatima is a low-cost, high-quality facility with a business family feel. And I know a little bit about the hospital, having started there at age 16 in the kitchen dish room. I joined the medical staff in '90. My mom was a PACU nurse. Uncle Tom was a physician there. And it's a place where everyone refers to each other by first name. It has a family atmosphere of great quality. That's why you see 2 or 3 generations of physicians, including my son. And that feeling is not lost on the patients we serve. In closing, my appeal today is more on a personal level. You see, it's not only about the potential benefit brought by a company, but it's more about the dedicated workers of all stripes that I have worked with over 30 years. As I mentioned, although I lack a finance degree, I believe strongly in the collaboration that exists among the medical staff, the employees, and management, which is truly a unique asset that transcends the P&L statement. My thanks to the DOH and AG for allowing me to comment. Thank you.
Thank you. Kate Novo.
You may speak, Kate. Ooh.
Okay, can you hear me okay?
Yes.
Okay, my name is Kate Noveau, Noveau. I am the System Director of Behavioral Health at Charter Care, both Roger Williams Medical Center and Fatima Hospitals. I have a team of over 40 social workers and oversee the behavioral health operations between both of our hospitals, including 2 psychiatric emergency rooms, 6 inpatient behavioral health units, and an outpatient program. At our daily huddle calls with all of the hospital emergency rooms in the state, we review emergency rooms holding patients and capacity on behavioral health units. On a daily basis, I hear reports that they need assistance with beds because they are boarding behavioral health patients in the emergency rooms. In fact, our only level 1 trauma center in the state routinely has patients waiting to be seen spilling over into their ambulance triage bays because they simply have no more room for them. Charter Care alone sees over 5,600 patients for emergency behavioral health evaluations a year in our emergency departments. We have over 100 licensed psychiatric beds with thousands of admissions each year, many from other community partners. There is zero ability for the other hospitals to absorb this, and even our own state psychiatric hospitals don't have the room to support these needed services for the patients. Charter Care regularly steps in to care for some of the sickest individuals in the state with some of the most complex needs you can imagine. We need a supportive owner that will continue to invest in resources to support the growing number of patients experiencing a mental health crisis and allow us to meet the needs of our patients. As it has been noted before, it's critical that we return to a not-for-profit status. As for-profit hospitals, we cannot compete with some of these other facilities in attracting good talent because we cannot offer loan forgiveness. This goes for social workers, for nursing, and for medicine. Also, we're not able to apply for any grants. We had no support or relief funds from COVID relief, and I've had to rely on the kindness of my colleagues and team up with other health systems just to get access to Narcan so that we could offer community-based trainings. Despite the worsening challenges we've had over the past few years, I do still love my job, and I'm proud that we offer such robust services to the neediest and the sickest population in the state. I'm proud of the outstanding team that I have, and I'm honored to lead them, and I really would like to retain them. We are the ones with the boots on the ground who know what our communities need, but our current ownership focus on profit means that we often cannot meet those needs. We look to Centurion to bring back a strong measure of local control over our services and decisions. I'm proud to work here, and I feel good that when people are at the lowest or most dangerous points in their life, we can help them. I'm looking forward to new owners who will allow us to run our hospitals, and I'm excited about the future work we can do. Frankly, I'm scared of what will happen if the sale does not go through. There are a lot of vulnerable people that rely on us. One way we know this is the letters that we get from patients saying things like, "There's no way I would be alive without you," or "You helped me through the darkest days of my life." Thank you for your time, and I hope that you would approve this sale. Thank you.
Thank you. Dr. Peter Pizzarillo.
Hello? Okay. Cool. Hi, I'm Peter Pizzarello. I'm an orthopedic surgeon here at Fatima. I've been at Fatima for about 18 years. My dad was an orthopedic surgeon as well. He was at Fatima for probably 30 years, so a long history here. And what I've learned over my time is that Fatima and Roger Williams are really important to the populations in the area. Not every patient wants to go to the big academic center. And more importantly, not every patient needs the big inefficiencies of an academic center. So they play a really valuable role. In addition to being an orthopedic surgeon, I'm a medical staff president currently, and speaking to my colleagues, the current status really just can't continue. It's a really challenging situation. I was also on staff at Memorial Hospital for a period of time and witnessed the fall of Memorial Hospital and the disastrous consequences it had to the local hospitals. Seeing something like that happen again really would be very difficult. So Centurion's application to purchase the hospitals is a lifeline. How often do we get a lifeline? How often do we get a second lifeline? In my experience, not very often. So these are really valuable hospitals. They serve a really important role. It's been good to me. It's been incredibly good to all my patients. Let's find a way to make this happen so this sale can go through so we can have local control again, nonprofit status, and continue our good care. Thank you very much.
Thank you. Maria Leonard. You could raise your virtual hand, please. Come back to me. Dr. Andrew Lemoy.
Hi, good afternoon. My name is Dr. Andy Lemoy, L-E-M-O-I. I'm one of the co-medical directors at the Wound Care Center at Fatima Hospital. I've been on staff at the hospital for over 20 years. I've been in the Wound Care Center for over 15. I want to just talk about our department and what I think it offers to the community and the importance of keeping it open. We see, I think, by far, I'm told, the most number of wound care patients in the state every week. We see about 150 to 200 patients every week. And for people who aren't medical, this is a big deal. These are people literally with non-healing holes in their body. When these people don't heal in a timely fashion, they go on to get infections, they become hospitalized, and it's very detrimental to them both physically and mentally. There's a huge impact when these people have these ulcers that won't heal. They can't work, they have social interaction problems, and they need to heal. This is what we provide to the community. If this were to, these people don't understand the gravity of it. These are limb and life-threatening conditions in a lot of cases. And if we are, in fact, and I'm correct, the busiest wound care center in the state, I can't imagine how the other hospitals would absorb this volume if we were to suddenly close. I really don't know how they could fill this need without a hiccup and without these people falling through the cracks. I think their care would be interrupted, and I think there would be loss of limb and even loss of life very quickly. We maintain these people and keep them out of the hospital. That's our goal. The other thing that's not as obvious, I think, to people who aren't involved in healthcare is how detrimental the closing of these two hospitals would be to the state's economics. If you look at our little department, and I say little after I say all this volume, but it's just one department in this hospital system. We refer to orthopedic surgeons like the last fellow who spoke. We refer to general surgeons. We refer to oncological surgeons. We refer to vascular surgeons. We refer to visiting nursing. We refer to people that Mr. Ventura, who spoke earlier, deals with supplies. We refer to durable medical equipment companies. We refer to orthotic and prosthetic companies where people unfortunately do lose limbs. And a lot of these companies are mom and pop small businesses in Rhode Island. And if these hospitals were to close, all of those referrals suddenly go away. And again, I'm not an economist either, you know, I'm a physician. But I can only imagine that this can't be a good thing for the state. You know, we look at people who work directly at this hospital, sure, all of our jobs are in jeopardy. But there's a lot of jobs in jeopardy that you wouldn't really necessarily think of if you're not involved in healthcare. A lot of these businesses survive because of this hospital system. And I think it's very, very important for both a medical standpoint and an economic standpoint, with all of this downhill revenue, to keep these two facilities open. Hopefully this makes a difference that we come here today and that we make these comments, but if you extrapolate what I just said about my little department over this entire healthcare system, I think there's a lot more jobs in jeopardy, and this is a lot more deep-reaching and far-reaching than the average person can appreciate. Thank you for your time.
Thank you. Mayor Charles Lombardi, please.
Wow.
Thank you very much. First, let me thank Jeff, the great job you do at our facility here in North Providence. It's a pleasure partnering with you, and thank you. And we're looking forward to continuing a partnership with you with this proposal. But my concern is for our taxpayers. This proposal needs to be fair to our taxpayers. Let me explain why. We entered into a 10-year tax stabilization with Charter Care. Next year, 25, will be the last year for that tax stabilization. And that the revenue that we're receiving, the taxes we're receiving, that in itself is a 50-cent tax increase every taxpayer in town. The average homeowner is going to pay approximately $144 per year at that rate, additional taxes. Every average homeowner, $375,000 home, with a 20% exemption, by the way. Now, in year 26, that tax stabilization goes away. Then it will be a cost to every taxpayer in our town of approximately $360 per year at this rate. That's our concern. I also want you to know that I realize how important it is to have that facility there. As a very, very active, young volunteer firefighter, there was a time when they closed that emergency room. And if there's some people in here that are as old as me, they'll remember that. They closed that emergency room, and I'll never, ever forget a very, very serious accident right at that front door, where we had to transport 2 patients to a neighboring hospital. So I also understand that part of this. But I just want to make sure that everyone knows, or you guys know, that I want to assure you, we want to be a partner in this merger, sale, but at what cost to the taxpayers of the town of North Providence? What can I say? We'll be looking forward to meeting with you. Thank you.
Thank you. At this time, I'd like to introduce Attorney General Peter Neronha to offer some comments.
Excuse me, you've all been sitting here longer than I have, so I'm not going to belabor it. I was expecting to say that, but I'm just really grateful that everyone is here. I guess I'm not coming through, so Josh is going to help me out here. Right now. Well, I won't belabor it by saying what I already said. Anyway, welcome, and I look forward to hearing your comments on the application.
Thank you. I'd like to call upon Cindy Fenchel.
So my name is Cindy Fenchel, F-E-N-C-H-E-L. I have worked at Fatima Hospital as a medical secretary for 46 years, but more importantly, I am the UNAP president of Local 5110 Service Workers, because, by the way, it's not only nurses here, it's support staff who work along with the nurses very hard. You all deserve it again. I want to thank the Department of Health and the Attorney General's office for conducting these hearings. It is very important to us as employees and union members that our community hospitals succeed. When we heard there was a buyer, we were all hopeful, but as my union brothers and sisters took the time to learn about the details of this transaction, we all knew it was not best for us and the community. Just take a look at my union brothers and sisters here today in attendance and last week. It's not because the union said, here's a flyer, here's the date, wear your purple shirts and sit here. It's because everybody wanted to have a voice and do it. And you're doing it without the guarantee of jobs, like some people. So everybody wanted to get involved because we all knew this deal, unfortunately, will not work for us. Our voices say, not now, no to Centurion. And to leadership, I appreciate the comments that we are a compassionate group. UNAP really thanks you for recognizing that, because you haven't seen compassion yet. 1 minute remaining. I respectfully ask you, the Department of Health, and Attorney General Neronha, to make the right decision for all employees, union members, our community, and our patients. We truly feel we will struggle with Prospect, but like I said last week, we will fail with Centurion. Thank you.
Thank you. Michael Pelicano.
Hi, my name is Michael Pelicano. It's M-I-C-H-A-E-L-P-E-L-L-I-C-A-N-O. I'm the Executive Vice President of Service Workers at Fatima Hospital. I've been working there for 22 years. Centurion is not putting any money into the hospitals. Their entire plan, as it stands, is unsustainable. If Fatima and Roger Williams Hospital could have found additional cost savings, they would have already done so and not be in debt. Centurion does not own or operate any other hospitals or have the necessary experience to know what it really takes to properly run a hospital. We do not need another company to tell us how to run the hospitals. We need a dedicated buyer that will be able to put money into these facilities and not run them into the ground or endanger the community by limiting medical care within the area. Rhode Island Hospital, Miriam, and other hospitals in Rhode Island cannot and will not be able to handle all the patients that currently look for their medical care at Fatima and Roger Williams. Jeff Liebman and company are just puppets for the Centurion Foundation and do not have our best interests or our backs for our patients and staff. As the Executive Vice President of the Service Workers Union, I work closely with Cindy Fenchel. We're both very concerned And I strongly urge both the Attorney General's office and the Department of Health to reject this transaction. Thank you for your time.
Thank you. Peter Leprang.
I'm not a public speaker, so please excuse me. My name is Peter Laprade, Laprade. I've been employed at this facility for 42 years. I started out at St. Joe's in South Providence. I would like to address 3 issues tonight. The first one, Centurion plans to have us make it as a standalone hospital by finding other avenues of revenue. In the past 4+ decades, our institution has not been able to accomplish this. Originally, we started out as St. Joe's Hospital and Our Lady of Fatima Hospital. When GRGs kicked in, St. Joe's Hospital in South Providence could not make it on its own. So an ER and OR were opened at Fatima, and everything was transferred from South Providence to North Providence. Since that time, the Fatima facility has lost obstetrics to women and infants, pediatrics to Hasbro, ambulatory care surgery to physician-backed surgery centers. We now stand to lose rehab to the new Johnston facility that's soon to be open. With these facts, how does Centurion suggest we find other avenues of revenue? This needs to be addressed. Fatima could not stand alone and merge with Roger Williams Hospital to form Charter Care. Charter Care could not make it on its own. Then Prospect Medical purchased Charter Care, was to be our savior. Look at where we are now. Number 2, Centurion wants us to borrow $133 million in their proposal. Centurion indicates that they will infuse $80 million into Charter Care, but that is borrowed money that will need to be paid back. Since the hospital has operated in the red for many years, how do we plan to do that? Number 3, as this chart shows, pertinent information related to the financial agreement between Centurion and Charter Care has been redacted. This is not visible to any of us. Services Centurion will provide are redacted, acquisition transaction services are redacted, corporate administrative services charged are redacted, and petition fees are redacted. All of this redacted information is being hidden from the employees and the community we serve. Because of this, I urge Department of Health and the Attorney General to reject this application. Thank you.
Thank you. Marie Grundy.
My name is Marie Grundy, M-A-R-I-E-G-R-U-N-D-Y. I'm a registered nurse and have been working in the endoscopy department at Fatima Hospital for about 6 years. Prior to that, I spent 34 of my 45 years in nursing working at Memorial Hospital of Rhode Island. Listening to Centurion's promises brings me back to 2014, when Care New England acquired Memorial. That plan ended in disaster with the closure of the hospital in 2018, putting an additional strain on Miriam Hospital and Rhode Island hospitals. And as a side note, it was like a slow, miserable death. I agree that a not-for-profit hospital has more potential than a for-profit institution, and we all know we do the best for our patients. We need to know how we can proceed. There needs to be transparency in this transaction. The redacted parts of the application, in my opinion, raises a bunch of red flags. What is Centurion trying to hide? What services will be provided? What fees are going to be charged? And what are the amounts of those fees, and when will they be due? The unions have fought for what we have in our contracts. Will those contracts be honored? And what about our health care benefits? And with this acquisition, no funds are forthcoming. Instead, Centurion wants us to borrow an exorbitant amount of money to exist. I'm sorry, but I can't wrap my head around this logic. Therefore, I ask that this application be rejected. Thank you for your time.
Thank you. Lisette Soares Sampaio.
Can you hear me? Oh, there we go. Lizette Soares Sampaio, Lizettesoares I am the Associate Vice President for Outpatient Services for Charter Care Health Partners. I've been with the system for 24 years, and through those years have seen many different changes, from reductions in pay in order to save jobs, straight through growth and development and opening 28 outpatient locations. I am certainly standing side by side with Charter Care Medical Associates, as it's one of the divisions I oversee. And all of our providers and our phenomenal staff want to do more for our patients and are unable to do more for our patients because of the restrictions that Prospect has put onto us, whether it is financial in approving positions so that we have the wonderful support staff to help our patients, or it's through equipment and supplies, new leases for growth and development for us to really have a good footprint throughout the state of Rhode Island. So in that, truly ask you to support Centurion. But I'm also here in the role, my favorite role, as a daughter to a patient of the system. My mother suffered a severe stroke in January of last year. And if it wasn't for the close proximity of Our Lady of Fatima Hospital and the phenomenal care that was provided to her in the hospital, certainly her outcome may have been significantly different. So we are at a juncture of where do we go? Do we lose the critical services that we have that serve our community, where patients will be at risk and have to drive further and potentially have an issue within the EMS? Or do we support Centurion and ask Centurion to put the faith back into our system? Thank you.
Thank you. Lori Miller.
I'm Lori Miller, LORRIE-MILLER. To the Office of the Attorney Generals and the Department of Health, I stand before you as the president of Charter Care Home Health, Local 5111, but I'm also an on-the-road clinician for home care. We have been struggling, yes, with Prospect, as we all have. And I've watched over the 30 years of practicing the decline in healthcare, but this has been the worst. But I don't, also on the other side, do not see or hear any, how things are gonna be different. How are we gonna change the issues that we're having of providing the care for these patients when we're out there? When there's no supplies, I haven't seen where Centurion is gonna help us get the supplies we need to take care of these patients. I see a lot of clinicians on the front line going about their way beyond on their personal time doing things. We have been stripped down to bare bones in the hospitals, out on the road in healthcare, that it's not safe. It's not safe for our people of Rhode Island. We care about our community and these people we see. On the average, I treat 6 patients a day. I spend about an hour with each patient. I'm the only OT for the agency. I travel near 100 miles per day. I have to do on my own time this, and so you look at traveling 100 miles per day, that's another 2 hours. I'm at, at least with the traffic and the roads. So I'm up to 8 hours. Then I have to do all my paperwork, which is another 2 hours. We don't get a lunch. We don't get a bathroom break. And then they just keep wanting more. I don't see how Centurion is going to change that with what they've presented to us. I see us going right back to, right along where we're at. We're parallel. Our system has left being a human service. It has went to the corporate world. It's not about caring for people. That terribly saddens me when I have to sit and watch some of these people struggling and no resources out there to provide for them. At this point, I can't support Centurion this sale. Thank you for your time.
Thank you. Lynn Redding.
Good evening. My name is Lynn Redding, L-Y-N-N-R-E-D-D-I-N-G. I was here last week, and we'll keep fighting the best fight that we can. We received a letter from the leadership stating that the union members seem to be confused. We're not confused. We see real problems in front of us with the Centurion purchase. Part of that is that we as the community, we as Charter Care will have to fund this. They may say that they're giving us $80 million. They may say that this is nonprofit. There's no such thing as nonprofit. Okay, there's no such thing as a free lunch. We're going to end up paying somewhere down the line. You'd think we would have learned when Charter Care was in favor of us merging with Prospect. We haven't learned. We understand that leadership is telling us that Centurion has met with us as a union and that they have met many of our demands. I'd like to know the name of the insurance company that they are saying we are going to have equal to or better than insurance. I'd like to see that document. I'd like to see that contract. We haven't heard or seen anything. We've also seen the sleight of hand, and that's what it comes down to when leadership and those who represent leadership at the hospital come forward and say, we need this, we're great hospitals, we need to support our community, we're the only hospital out there that deals with those who are suffering and don't have the financial wherewithal. We know that. We know that. But that is not speaking to Centurion's viability. So that's the sleight of hand. They're telling you how desperately we need to stay open. But this is not the group to take care of us. We can see that because we're putting up the money as Charter Care. It's not just the nurses. We're talking hospital staff members are saying the exact same thing that we are. We just happen to be here in force right now. But you have a lot of members of the hospital, a lot of staff members who know that this is simply jumping from the frying pan into the fire. And we also know that there is regulation in the state of Rhode Island that you can't simply just close the door on a hospital. So the fact that they are using that as a fear tactic is not helping. And we really need to have the Department of Health and the Attorney General's office spend that quality time, look at that application and realize that this is nothing more than a red herring. Thank you very much.
Thank you. Chris Kalachi, please.
Chris Kalachi, C-A-L-L-A-C-I. General, good to see you, your staff, Department of Health, everybody else, good evening. There is an 800-pound gorilla in this room. It's called debt. And that's what this business model is. Hospitals that are losing their lungs are going to borrow $133 million, take on $100 to $300 million in interest on top of that, and miraculously survive. I've heard testimony about how this is the only option. Maybe it is, maybe it isn't. Because it's the only option does not make it a viable option. You do not saddle failing hospitals with hundreds of millions of dollars in debt and expect them to survive. I heard testimony about how we are going to convert from for-profit back to not-for-profit. You saddle failing hospitals with hundreds of billions of dollars in debt, they will fail. You restore local control. On its face, not a bad thing. You saddle failing hospitals with $133 million worth of debt plus interest, they will fail. Then you look at the application and you vet the experience or the lack thereof that Centurion brings. They highlight in their application their experience in healthcare. Here's what it is. They point to 3 projects. The Ascension Seton project. That was about a leasing strategy of a 4-story, $156,000 square foot facility in Texas. Example number 2, the Multi-Care project, a 4-building sale leaseback agreement. Anybody in this room who gives any thought to what a sale leaseback agreement means and what that can mean for these hospitals, we're in big trouble. The 3rd example, the Infirmary Health System project, which involved financing a 4-story, 79,000 square foot facility. We don't need a leasing strategy here in Rhode Island. We don't need financing help for a 4-story building. We do not need a sale leaseback agreement. Look at Stewart across state lines, and we know what that means. We don't need that. We need capital, and we're not getting it in this business model. Lastly, Mr. Mingle, Mr. Lehman started this hearing by saying that they have given us a proposal on medical insurance. I am the chief negotiator for the union in those negotiations. I have no information on the dental plan, no information on the vision plan, no information on the wellness program. And what I have with respect to the medical insurance plan and the prescription plan is so lacking in specificity and detail that I can't do a comparative analysis and know how it measures up to the current benefits. For all of these reasons, reject this application.
Thank you. Jeff Betchen.
Mr. Betchen, you have been unmuted.
Good afternoon. Thank you again for the opportunity to speak. My name is Jeff Betchen. Last name is Bechen. I'm currently the National Director of Revenue Cycle Operations for Prospect. I started with Prospect at Charter Care and was promoted up into the national role. And once the sale transaction goes through, I will be staying with Charter Care, thankfully, as the Vice President of Revenue Cycle. Some things that I think are important to know is our performance. We've heard a lot about plans. We've heard a lot about, emotions and whatnot. How do we perform financially? If you set aside the overhead costs that are being laid down upon us with the current organization, set that aside. We have a denial rate for insurance claims around 5%. 4% is considered 90 percentile for industry standards. And of the accounts that get denied, we actually recapture roughly 70 to 75%. That is also close to the 90th percentile. We do all this with inadequate computers, inadequate IT infrastructure, inadequate network viability. It's up, it's down. If we can free ourselves of all of these costs that are associated with our current structure. The money won't go to California. The money will stay here. We can make plans and work together. And for those that think we can stay with Prospect and we can continue to struggle, take off the blinders. The hay's in the barn on that one. This is a moment in time that we can't get back. Are there other options? No, unfortunately, at this point, they aren't. But what I can tell you is this organization can function. On our own, we can do it. I know it. And from a personal standpoint, as I sit here and watch the video, I see Dr. Espat, and that man saved my life. And he basically walked off an airplane tarmac and came right to the hospital to do surgery for me. That is what this place is all about. If we're going to sit here and talk about the contracts and things and throw bombs at each other, that accomplishes absolutely nothing. It is a waste of time. We need to try and work together to see what we can come up with. But, you know, that's going to be very difficult to do if we don't table some of the emotions. I understand that's a very easy thing to say sitting here in the ivory tower at my home office. But we have to figure out a way. And I implore you to approve this application. Thank you.
Thank you. Richard Sweeney.
Good afternoon. My name is Richard Sweeney. It's S-W-E-E-N-E-Y. I work in talent acquisitions as a recruiter, but my first interaction with CharterCare was taking a family member daily for 6 weeks to the cancer center. The care, the compassion, and the professionalism was outstanding. And that's to you people. I then started to work here, and it is a privilege to work here. So I stand here today to rise in support for the purchase of CharterCare, OLF, and Roger Williams Medical Center by Centurion to ensure the viability, the stability, and the sustainability of these two community hospitals, the care that they give to these many communities that they serve. Thank you.
Thank you. Karen Curran.
Hi, my name is Karen Curran, K-A-R-E-N-C-U-R-R-A-N. I have not been with this hospital, Fatima, for very long. As a matter of fact, I'm still on orientation, hoping to come off soon. But I'm familiar with the struggles of the hospital through my association with the union for many years at Rhode Island Hospital. And I've seen what they have gone through. This proposal, with its redactions and with its nebulous statements, reminds me of someone who earlier this year told Congress, let's pass this bill so we can see what's in it. Let me tell you, that's no way to do business. As it stands, if you have not read the contract, which is about the application, which is about that thick, and we've had parts of it at meetings read to us, quoted directly from that. I challenge you to read it to see what the financial implications are, because if you just go by what somebody tells you and you don't read the document itself, you're not really going to know what the implications are. Somebody already mentioned that Centurion is expecting us to come with untapped resources that have not been able to be found over the last number of years. And then when all untapped resources have been exhausted, the only thing that you can do is cut staff. And already the staff at Fatima has been asked to work extra shifts every graph on call. Okay, maybe on call doesn't sound bad, but more often than not, you are called in for on call. When you are hired, you are committed to the number of hours a week that you are willing to work, and then you have these hours on top of it. Suzanne Gordon, in her 2 books, Nursing, Safety in Numbers and Nursing versus, I gotta get the other one, sorry, Nursing versus the Odds, presented many sources of research that showed that if you start cutting your staff, you not only compromise the morale of the staff, but you compromise things like bed sores and infections and things like patient safety. And patient safety is one source of income that can be easily withheld by Medicare, and we serve many Medicare patients if we do not meet their standards. And the less staff there is, the less we're able to meet those standards. So while they may be scrabbling to try to find these extra resources, if the staff has to continue to be cut, we have a great chance of having less resources from government sources. So there are a number of things that make this not a viable thing. At least we need, like was mentioned, the transparency. We also need time for people to look at it and really see what the implications down the road are going to be. It may not be the saving thing. There may not be another, we don't know. But we at least deserve a chance to see what's involved, how it's going to affect us, and how it's going to affect our community. Because not only is it going to affect the loss of, not only could it affect the loss of hospitals, community hospitals, which is tragic enough in itself, but it could also affect the loss of community members through increased morbidity and mortality. And that's something we can't afford. So I urge you to reject this at this point.
Thank you. Marana Lebucine. Cynthia Williams.
Good afternoon, Cynthia Williams, CYNTHIAWILLIAMS. I work for the Cancer Center, and I've been with Charter Care for 16 years, maybe more, maybe less. But I can tell you that I am all for us to go with Centurion, because as of late, it's been very difficult to get supplies for our patients, and it's causing us to not be able to perform 100% patient care. And I'm there for my patients. My patients are my world. And it's not just, I'm a medical assistant, and it's not just being a medical assistant, it is also caring for not only the patient themselves, but it's also caring for the family and incorporating all that into the care. And like, we've been having a hard time getting bone marrow biopsy kits for our patients. And I work with Dr. Colvin, and him and I do on an average maybe 15 a month, maybe more, maybe less. I don't know exact numbers, but working for Charter Care I've been there through being nonprofit, being for-profit. I don't care about all that. I care about my patients. That's what I care about, and how the care is delivered to our patients in our community. And I just really want this to be over with. I really do, because it's affecting patient care. And that's first and foremost important to me. Thank you.
Thank you. Ryan Pagliaro.
Good evening, everybody. While we appreciate the sentiment that our patient care is excellent, we know that this is not what tonight is about, or this application. So tonight I stand by my union brothers and sisters in asking the Office of the Attorney General to not approve this deal in the current form. Approving this deal would be nothing more than a Band-Aid or a half measure, and would further jeopardize the long-term healthcare system of Rhode Island. We can't afford any more big hits in this state, especially when the amount of money that will be siphoned out of this hospital is currently unknown to the public. No one knows how much money Centurion is going to command in order to load Charter up with debt to keep us afloat. Their website that boasts this deal states Centurion's mission in practice calls for reinvesting profits into their facilities, people, and the communities they serve. That might be hard to do when factoring in the current profits against the interest of these potential bonds and loans. I hear a lot of boasting about switching to a nonprofit. Nonprofit does not mean absolute wellness, becoming debt-free, or sustainability. We can all remember it took around 4 short years for Care New England, a nonprofit healthcare company, to decide to close Pawtucket Memorial Hospital. Approving this deal with this amount of uncertainty could mean we're in the same position we are now, or worse, in a few years. I challenge administration today to tell us that they even read the application, that this deal isn't 100% debt financed, and I want them to acknowledge how risky this deal would be. It's no question that we do have great staff and provide excellent patient care. That's not what is up for debate here, and there needs to be another way for Charter Care to survive at this time. And Centurion is not the answer. Thank you.
Thank you. Katrina Galek-Sabert.
Good afternoon. It's Katarzyma Gilek-Seibert-MD. Good afternoon. I'm a director of rheumatology for Charter Care and Roger Williams. And the role that I'm most proud of is being director of rheumatology fellowship training and being a clinician in our busy rheumatology practice. At this point of time, I trained about 1/3 of rheumatology workforce in the state of Rhode Island, and more to come to entire country and beyond. And I'd like to also share with you something that not many of you may know. We have 4 decades of rheumatology program. Actually, this is how rheumatology started, training program in the state of Rhode Island, and later on Rhode Island opened the hospital. We collaborate with all sister hospitals. So it's about continuity of learning, education, patient care. And also probably not many of you know that my fellows provide care to veterans in VA Medical Center across the street, which is very good for busy fellows and other trainees. So this is very important, the continuity of care that we provide for multi-generational families that we see. We saw first-generation migrants, Spanish-speaking. I actively am learning Spanish right now because I want to communicate with my patients in their native language. But we also see next generation, second and thirds of Rhode Islanders that keep care in our facilities. And this is what I'm looking for, continuation of that and continuing training as a Roger Williams program director. Thank you.
Thank you. Dieter Pohl.
Yeah, hi, good afternoon. It's Dieter, and last name is Pohl. I'm a surgeon at Roger Williams Medical Center in Fatima as well. I've been here for 25 years and I've seen it up and down many times, and it's always survived. And I think right now, again, difficult situation, and people have mentioned that, but I think we have the opportunity to get kind of like the best of both worlds, or all worlds. We can get the administration that we have, has been doing a good job. We will get more direct access to the administration, doesn't have to go through all the channels anymore. If we become self-administered again and non-for-profit, I think that will be very helpful to build programs that we need to build and we can build here. We have the manpower, we have the physician knowledge, we have the staff. But the other thing that's very important, I think, is that we get the financial background for this. People always say it's all debt, 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 but everything is financed by debt. I mean, this is just how the United States runs. So the question is, what kind of debt are we getting? And I think Centurion gives us the best chance of getting good, affordable debt. And I think that's why I'm for this. I think this is a great financing company with a great administration and a great staff, and we can do good things for our island. So I'm for the sale. Thank you.
Thank you. Lynn Blaze.
Good evening. My name is Lynn Blaze, B-L-A-I-S, registered nurse for 40 years. I'm proud president of the United Nurses and Allied Professionals. And I stood up last week. I stand again this week. But I have my entire 40-year career spent in this system. I've had my children in this system. I've had my surgery in this system. I want to end my career in this system. But the way this deal is set up, I am almost guaranteed that those doors will shut before I finish my career. We cannot have a deal with Centurion that is all debt funded. There's no way that that makes any sense to me as a registered nurse, not as an economic person. But you cannot finance $133 million in healthcare and expect that you're going to be able to pay that debt back and move forward. I'm proud of the people I work with. I'm proud of the services we provide. And I don't think there's any question about that. And we've heard a lot from the administrators sitting on that side of the room, the physicians that have been here. And I'm grateful that they acknowledge and they see that. I have been a local leader for my 40-year career. I've been the president of the local for 36 years up until my new role. And I turned it over to my trusted colleagues to run the RN local. But I have been through easily 7 or 8 CEOs. I can't tell you how many personnel directors I've been through. We have bargained and negotiated contract after contract in the good times and the bad times. I was there when St. Joe's and Providence closed. I became a registered nurse from St. Joe's Providence ER to Fatima ER. I've worked in surgical services now for the last 20 years at Fatima Hospital. So I know that we can work together to find the deal, and a deal that works. This is not the deal that works. So I urge you to reject the deal as presented. Thank you.
Thank you. Maria Leonard.
Maria, you're unmuted.
Okay, thank you. Can you hear me now?
Yes.
Okay. I apologize I couldn't be there in person, but I did want to take a moment to just share my perspective, and I'll just give you a little bit about my role here. So I've had the benefit of working or supporting, volunteering really, on the advisory board for Roger Williams Medical Center, and for the last couple of years sitting on the board for Charter Care. My background is I'm in the financial services industry, where I currently serve as the Chief Compliance Officer for Citizens Bank. And suffice to say, I've spent my whole career in financial services. What I would share is that the current situation that we are in is not ideal, nor is it sustainable. And we have one option on the table, which is to have Centurion step in and support the organization. I am supporting it because it brings control back to the local team. It brings the revenue back to investing. That nonprofit status means we can invest the earnings back into the local community and support the community in ways that we don't have full control over today. And overall, I think that, the future of this franchise is really dependent in having someone step in to provide that financial support. So I do support this deal. Thank you.
Thank you. Marana Lebucine. Nikolenka Henry.
Nikolenka Henry, you have been unmuted.
Is there anyone else in attendance who would like to provide comments but has not had an opportunity to speak tonight? Please raise your virtual hands as well if you're online.
Kimberly Valente, you are unmuted.
Thank you. Can you hear me?
Yes.
I am definitely in support of the sale. I think that Prospect has made it clear that one, they don't want to own the hospital any longer, so people can comment about this not being a good sale, but you basically have an owner that doesn't want you anymore. They're looking to get out of this. You don't have people pounding on the door looking to invest in two hospitals that are failing. And that's the reality, they're failing. The patient population that CharterCare serves is a low-income community. Much of the care is seen through the emergency rooms, and we're at risk of those emergency rooms shutting. Prospect owed $24 million to vendors, and if it wasn't for the Attorney General of Rhode Island having foresight and having them put aside an escrow account to pay back those vendors, we would continue to have to cancel surgeries and procedures because we were not able to get the equipment that we needed. All of this is available and known in the papers. As far as the staffing and the current conditions and the pay and all of that, that's under your current owner. So I don't know how you think by blocking the sale, that's going to improve the current conditions. It seems like the only viable option is Centurion, who's reaching out and offering to give us a lifeline. And if there are things that we need to work with them on, if there needs to be more transparency, they seem to be open to working with us. They haven't shut down anything. They've been forthcoming, but you don't have many options left. And I go back to the last meeting, I talked about what happened in Pennsylvania and how that hospital was shut down. And I don't know if anybody has bothered to research that, but the nurses showed up for work that morning only to find a sign on the door, and the hospital was closed without warning. We are, the difference between profit and nonprofit. A profit organization expects you to turn a profit, which we are not doing. So you can't force an owner into keeping you and say, we want more money, we want to be paid more, we want better working conditions. They can't get us at a point of being profitable, so they're not going to invest money into those things. That's the reality of the situation. Centurion at least gives us an opportunity to work together as a team. This is one of the strongest leadership teams that I've seen at the local level, and I've worked at in two of the largest Boston academic hospitals there. This team is incredibly strong, and I have faith in this team, and I have faith that they will work with Centurion in the best interest of both the Charter Care employees and the Rhode Island residents and community. Thank you.
Thank you. Mikalenka Henry.
We would like to know how much money was allocated for experts for both the Attorney General and the Department of Health, and how those funds were allocated, meaning who was hired.
Thank you for your comment. I would remind everyone that the intent of the public meeting is for the Office of the Attorney General and the Rhode Island Department of Health to hear comments from the public. For this format was not scheduled to be a question and answer forum. So if you pose a question, it will be part of the record, but and will be considered by both agencies, but we will not engage in a question and answer exchange here.
Well, we will pose a question as to why there is absolutely no transparency with respect to the application. Many pages have been decided. So exactly how do you expect the public to have any cogent commentary?
Thank you for your comment. Is there anyone else in attendance who would like to provide comments but has not had an opportunity to speak tonight? Please raise your virtual hand as well. Come to the microphone.
Hi, my name is Dawn Marie Leonardo. I was VP of the lab. I've been at Fatima Hospital since the year 2006 and seen it go through many things. I've also worked at Kent for 11 years, and I've also seen them go through voluntary reductions and whatnot, and changes and everything. I hate speaking in front of people, but in my mind way, I can't imagine going to the bank and saying to them, I'd like to buy this $1 million home. I have a lot of people that are willing to show me how to do it and how to maintain it. But, well, you know, with my measly hourly pay, I know I can do it with them advising me how to do it. By the way, if you want any details, you can just forget it. This is going to be redacted. But you trust me. Don't worry about it. It's all okay. I did read through a good percentage of what was on the website with Attorney General Neronha. And yeah, vague, just vague. The only thing that's clear is this is not a good option. I can't even remotely begin to trust anyone that leaves big blank spaces and everything, gives me vague incentives on things, has no experience hardly, and yes, I read the purchase agreement. I'm so glad that all the higher-ups are going to be guaranteed their job, and we're getting 200 more IT service people, managers and stuff. That's just awesome. But they make the most money. They haven't been able to do anything. We're the little peanut on the pod that have just worked for a contract that finally brought us up to par. They're not even considering to talk about that to us. So yeah, I can't be for this at all. I can't even remotely be for this. And I believe my brothers and sisters feel absolutely the same way. Thank you.
Thank you. So is there anyone else in attendance who would like to provide comments that has not had an opportunity to speak today? Hearing no one, this concludes our public meeting of the Centurion Foundation, Inc.'s hospital conversions application for the proposed acquisition of Roger Williams and Our Lady of Fatima hospitals. Thank you for your participation and good night.